first thing you do before any assessment is practice proper hand hygiene and introduce yourself. Next, you provide privacy. Begin your assessment with a health history. Start by asking the patient if they've had any gastrointestinal problems, such as abdominal pain, digestive issues, or heartburn. If so, go through your old cards assessment. Next, ask if they've had any renal or urinary problems. If your patient replies yes, go through your old cards assessment. Always begin your abdominal assessment with inspection before you do anything else. So first, expose the abdomen. We're inspecting for skin color to make sure it's natural for her skin tone. We're looking for scars, striae, any dilated veins, rashes or lesions, and hair distribution. Next, we're looking at the umbilicus. First, you want to make sure that it's midline. Look at the color to look for any cyanosis, the contour to make sure that it's not herniated. Then we look at the contour of the abdomen. You can see here that hers is flat, which is normal. Then we're looking for signs of peristalsis. If you see any waves of peristalsis, this may indicate an intestinal obstruction. Next, we're looking for pulsations. These would be found in the aortic area. If these are present, that may indicate an abdominal aortic aneurysm. The next portion of the abdominal assessment is auscultation. You will listen to each quadrant of the abdomen for bowel sounds. You will hold your stethoscope in place until you hear active bowel sounds. This could be up to a full minute before you stop listening and document your findings. Next, we're going to listen to the abdominal aorta to check for bruit. You do this with the bell of your stethoscope. And that concludes the auscultation of the abdomen assessment. The next portion of the abdominal assessment is percussion. You do this by placing your non-dominant hand finger on the abdomen and percussing with your dominant hand. You want to be sure to go through all quadrants and report any areas of tympany, dullness, or tenderness. Next, we will assess the liver using the liver border scratch test. You do this by placing your stethoscope at the midclavicular line at the base of the ribs. Lightly scratch up 1 to 2 centimeters at a time until the noise gets louder. This is where the base of the liver is. Next, we're going to test tenderness of the costovertebral angle using fist percussion. Have your patient sit up. You'll find the costovertebral angle where the ribs meet in the back. You're going to test for tenderness by taking your fist and lightly tapping on your hand. Once you've performed all those assessments, you can finally move on to light palpation. Do this with alternating movements with each hand and lightly palpate and ask the patient to report any feelings of tenderness or pain. To conclude your abdominal assessment, make sure to tell your faculty member 3 risk factors for hepatitis A, B, and C, and 3 risk factors for colorectal cancer. Thanks and good luck!
Hey, Simon and Simon, did you ever watch that? No? Okay. How about you, Mark?
Maluse of equipment. I think these go here.
Now we'd like to demonstrate some appropriate behaviors for the Idaho State University Nursing Lab. Computer work. Proper hand hygiene. Alternate hand hygiene.
Equipment hygiene.